So now we're moving on to the thoracic spine. So for thoracic spine, I'm going to only be doing inspection. In this video, I'm only going to be doing inspection, active range of motion, and costal vertebral expansion. No passive range of motion, no resistive range of motion. That's because that's the way we were taught in class. It can be detrimental to the patient, so we're just not going to be doing that passive range of motion or resistive range of motion. Okay, so first I'm going to start with inspection. Inspecting, I'm just looking to see if there's any redness, any muscles that could be atrophied or hypertrophied, one side more than the other. Looking to see if there's inflammation, edema, some pathology such as like a tumor growing or a cyst or something else. And I'm going to be doing palpation, starting with temperature. Okay. It feels a little warmer on the left side, not too much, mostly over the spinous processes. I'm going to be doing now superficial palpation. Does any of that bother you at all? Okay. Also touching his ribs. Now deep palpation, checking those muscles, supraspinatus right there, the scapular spine, superior angle of the scapula, inferior angle of the scapula, doing that bilaterally. Those muscles there, serratus anterior, costal vertebral muscles, checking those ribs. You might have a rib fracture, so you want to check that. Checking the spinous process. Tenderness here? No. No? Okay, what about here?
A little bit.
Okay. And then, that's it. So now I'm going to be doing active range of motion. Active range of motion. So I'm going to be asking you to move around. Let me know if you feel any discomfort. Okay, placing this top thing of the inclinometer at T1. Zeroing it out. Finding T12. Placing the bottom one at T12. Zeroing that down and that down. Okay, so go ahead and try to touch your toes slowly. I'm going to tell you when to stop. Alright, stop. Okay. 40 there, 30 there. So that's 10 degrees. Normal is 20 to 45. Now I'm going to come back to neutral. 0, 0. Now extend your spine back. There you go. Stop. Alright, 20 and 10. So 10 degrees. Normal extension is 25 to 45. 25 to 45. So there we go. Now go ahead back to neutral. For lateral flexion, we place this over T1. Zeroing that down. And this one over T12. Zeroing that down like so. Go ahead and put your arms at your side. There you go. Now try to bring your left hand down. I'm going to ask you, no, so there you go. Alright, can you go more? Stop. Perfect, 10 degrees here and 30 degrees here, so 20 degrees of left lateral flexion. Normal, that's normal for lateral flexion is 20 to 40. So come back to neutral, 0 and 0. And then now try to bring your right hand down. Stop. Yes, 30 there and 45 there. So 15 degrees, almost 20 to 45. Come back to neutral. So for rotation, sir, can you come a little bit back? Oh, no, so walk back. There you go. Now I'm going to ask you to bring your arms forward like this and bend forward all the way you can. Like that. All right, pretty good. And then when I ask you, you're gonna rotate like that. Try it. Rotate to the left. There you go. Perfect. All right, bringing this back to 0. T1, finding T12. Okay, bringing that to 0. And that to 0. Go ahead and rotate to the left. Perfect. 10 degrees there. 25 degrees there. So 15 degrees. Normal is 35 to 45. 35 to 50 degrees. Yes. Now go ahead and do that to the right. Is that it? All right, so 5 degrees here. No, go ahead. 35. And yeah, 5, so 30. So again, normal 35 to 50. Any of that bother you? Okay. Again, we would not do passive range of motion or assisted range of motion nor end fields for the thoracic spine or lumbar spine. Okay, so in the last video where I did active range of motion of the thoracic spine, inspection, palpation of the thoracic spine, I said that I was going to do costa vertebral expansion, however I didn't. In this video, I'm performing costa vertebral expansion. Go ahead and extend your arms out like that. I'm going to bring this forward. Really tighten that up. Okay. Go ahead and relax. Okay. That's nice and tight. What I want you to do is go ahead and take a deep breath. All right, and exhale. Perfect. So what I did is I looked to see if there was more than 3 centimeters of expansion when he inhaled, which there was. He had 3.5 centimeters. Less than 3 centimeters, or 1 inch, less than an inch of expansion is positive for and indicative for ankylosing conditions or lung problem. All right, so go ahead and stand up. This next test, it's called the Adams test or Adams position, Adams sign. Go ahead and turn that way. His back is exposed. Actually, you can go ahead and turn this way. Perfect. So what I'm doing is I'm palpating. I'm going to be palpating your back, letting you feel any discomfort. I'm palpating to see if I find any change in his curve or any rib hump that might be indicative of a scoliosis. This test is to determine functional versus structural scoliosis. If I were to find a rib hump, which there is slightly one over his left area, it's a little bit more standing out. I would ask him to go ahead and bend forward, try to touch your toes, relax your arms, try to touch your toes. And then I would see if that rib hump went away, which it did. So that's a functional, positive finding for functional scoliosis. If he were to still have that rib hump, it would be a positive finding as well for structural scoliosis. Okay, so this next test is called the sternal compression test. I've already asked the patient to lower his gown. This is okay to do for males. If it's a female, obviously, she would still have the gown. I would ask her to spread her breasts, and then I would apply the force. Since he was okay in lowering his gown, we're going to go ahead and do it this way. So, sir, I'm going to go ahead and apply some compression in this area. Let me know if you feel any pain or discomfort. Okay? Pain or discomfort? No? Positive finding would be pain or discomfort, and that would be indicative for a rib fracture. Okay, so this next test, it's called the Sheppelman's test, and what I'm going to ask you to do is face that way. Okay, and so can you go ahead and stand back. There you go. I'm gonna ask you to try to side bend your right hand down. All right, pain or discomfort?
No.
Now do so on the left. Side bend on your left side. Pain or discomfort?
No.
Okay, if I'm gonna keep you in this position, go ahead and side bend to the left. If he had pain on the compression side, that would be positive test for neuritis. If he had pain on the lengthening or convex side, that would be positive for pleurisy or strain. Okay, so this next test, it's called the Weaver's test. I've already asked the patient to put his gown up and then lower this a little bit. So, okay, so do you have any pain or discomfort anywhere? No? All right, so what I'm gonna ask you to do is crunch up a little bit. I'm looking at the umbilicus. You can go ahead and relax. His umbilicus stayed center. Positive findings would be if his umbilicus would travel up, migrated down, up into the side, to the either side, or down into either side. It's indicative for a lower motor neuron lesion involving the nerve roots of T6 to T12. If it migrated up, it's involving nerve roots of T10 to T12. If it migrated down, it's involving nerve roots of T6 to T9. If it migrated to the right, it's involving that left quadrant. So if it's up into the right, it's involving the left lower quadrant. And